All right, time for our Tuesday morning appointment with Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Always good to see you, Dr. Bogoch. Let's start this week with an issue that really a lot of us, I think, are dealing with right now. Many people have been fighting off, one kind of infection or another over the past couple of months, but it's certainly, and I can say this around the newsroom, left a lot of people with a cough that's been lasting weeks and weeks. So what is this a sign of, and how worried should we be about the fact that this is kind of lingering so long?
Yeah, many people get what's called a post-infectious cough, sometimes known as a post-viral cough. Up to 25% of people can get this, and it's really obnoxious because this cough, even though the acute illness is over, the cough can last for anywhere from 3 to 8 weeks. Obviously, it's a diagnosis of exclusion. There's lots of things that can cause a cough, and it's important that we don't miss underlying medical conditions that cause this. But sometimes after a virus or a bacterial infection, your airways get a little bit more sensitive, and people have this persistent cough, and it can be very troubling. Like, it can keep people awake at night, and certainly can be rather disruptive. But if it is a true post-viral or post-infectious cough, it will subside with time. It usually takes a few weeks. But of course, if there's warning signs, you've got to get checked out. If there's blood in the sputum or blood in the cough, if there's difficulty swallowing, if there's shortness of breath, these are signs that you don't want to wait weeks to see a physician. You want to see someone much sooner than that. But without the warning signs, and if it's a mild cough that's obviously a little bit disruptive, this tends to get better on its own with a little bit of time.
And let me quickly follow up, because a lot, we got so freaked out about coughs during COVID, right? It was like, you were like a leper if you were sort of coughing back in the sort of pandemic days. Are these post whatever coughs, could they be contagious? Like, if I'm coughing around, I hate to do it, but try to cover with your elbow, et cetera. But how much of a threat or a danger do I pose if I'm coughing like a lot of us are right now?
None. I mean, the infection is over. I think the tricky part is figuring out when is the infection over and when does the post-viral cough begin, because there's certainly going to be a gray area in between. But we know that people with, bacterial pneumonias or viral infections, they're typically not contagious for weeks and weeks and weeks on end. And there is this transition into a post-viral cough. But you raise a good point, because, I think pre-pandemic, it wasn't acceptable, but we still saw people coughing at work, at school. We didn't like it, but I think we tolerated it more. Now, I don't think there's much tolerance for that, and people sort of cower away and think, like, what are you doing here? Go home, you're coughing. But with a post-viral cough, a true post-infectious cough or post-viral cough, you should not be contagious to other people. It's just a lingering cough. It's almost like an asthma-like process that's happening in the lungs that's temporary. So you're not transmissible to other people, but other people don't know that.
Yeah,
so,
exactly.
I mean, it's hard to navigate the social aspects of this, I think.
No doubt about that. Okay, I appreciate the clarification there, Dr. Bogoch. In the meantime, you recently highlighted some data about flu and COVID levels, COVID trends, really. This is from the CDC in the U.S. But, what does the data show, and how applicable is it to our respiratory virus levels here in Canada?
Luckily, we're seeing most of the metrics in decline: the wastewater surveillance, the number of hospitalizations, the number of deaths, the percentage of tests that are positive. So, it's still fair to say there's COVID out there and people can still get COVID. I think that's extremely important to mention. But, when we look at how much there is now versus how much there was over the holiday season, yeah, it's in decline. But, like a roller coaster, it's going to go up and down and up and down. And we know it's going to go up again. We might have a bump in the spring. We'll obviously have more in the fall and winter of next year. It's not gone. It's going to circulate throughout the year, just at sometimes with higher levels, sometimes with lower levels. Fortunately, we're in decline from, rather significant COVID and flu transmission over the holiday season. Okay,
we're a bit tight for time. Only a few seconds on this one, but you recently co-wrote this article looking at our response to COVID, how Canada and various arms of the government could perhaps do better, work together. What was the kind of goal? What are you arguing for here, and how could it help sort of future pandemics?
Yeah, thanks for bringing this up. I mean, obviously, public health plays a very central role. Some places are taking a much more comprehensive approach, intersectoral approach, looking at how to build more resilient countries involving every sector, including, transportation sector, agriculture sector, all the various sectors, and just build resiliency within all those sectors such that we have a coordinated approach to health emergencies, including epidemics and pandemics, and something like a broad scoping approach like that might make a much more resilient Canada for the next health emergency that we face.
Okay, Dr. Bogoch, always appreciate the time. Thanks for joining us, and we'll see you next week here on CB24 Breakfast.